A sunny day right here in the city of Douala. Good day, ladies and gentlemen. Thank you for joining me on yet another edifying edition of the program You and Your Health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. A total of 1,888 cholera cases have been detected in 5 out of the 10 regions of Cameroon. 38 of the cases were confirmed between the 4th to the 10th of March 2022 in 24 health districts. According to weekly reports from the Public Health Ministry, 55 people have died from the disease nationwide, and the southwest region of Cameroon is the region with most affected cases. After this short break, I will be telling you more about the disease with my guest. Welcome back. On the line in the southwest region of Cameroon is Nurse Liger. He is a public health specialist and he'll be telling us more about cholera disease, which is already affecting several parts of Cameroon. Good day, Nurse. It is a pleasure having you on the program once more.
Thank you, Immaculate. It's awesome to be on the program with you again.
So, Nurse, we are talking about rising cholera cases in Cameroon. What exactly is this disease that is having a very devastating effect on the population?
Cholera is primarily an infection by a bacteria, and this bacteria affects the GIT, that's the intestines primarily, and it causes intestinal disorders. The most common one is diarrhea and vomiting. Those are the clinical symptoms of cholera.
So,
yes.
Yeah, can get you.
And if you don't treat cholera, it usually has a tendency to kill the victim within hours. Normally, it kills children within 7 hours of infection.
Mm-hmm. So now, what other complications can come as a result of having cholera?
Yeah, the most common one is dehydration. You know, since you're passing out a lot of stool and then vomiting, you are losing fluid. You are losing the fluid in your body, and the body is 60% water. So when you lose so much water, your body can't function properly, and then you'll become dehydrated, and that is primarily the cause of death in cholera. Mm-hmm. Then the second is electrolyte imbalance. When you are losing the fluid, you are not just losing fluid, you are losing ions, you are losing chemicals in your body, like sodium, like potassium, like calcium, like chloride. And when you lose them, the first thing that may happen is that you may develop seizures, because calcium is what is responsible for your body to be contracting properly. Your body, your muscles will start contracting the way they like, relaxing the way they like, and that's what they call seizures. Or your body may no longer respond well to stimulus. You may lose consciousness because of the dehydration and the electrolyte imbalance.
So, Nurse Liger, tell us, how can I differentiate between cholera and dysentery?
The primary difference between these two is that with cholera is usually considerably more severe than dysentery, and the stool with cholera is more frequent, more watery, and usually accompanied by vomiting in the early hours. Mm-hmm. Dysentery is a long disease. It's not as acute as cholera. It is a more slow-acting disease, and usually affects the GIT in such a way that by the time the diarrhea starts, it's usually bloody.
Mm-hmm. And now, who is more susceptible to suffer with cholera?
Sorry?
Who is more susceptible to suffer with cholera, to be infected with a disease?
Yes, anybody that lives in an environment where there is poor access to clean water is at risk for developing cholera. But the greatest people are those that live in crowded areas. And that is why you will notice that the southwest region is one of the most hit regions, because due to the crisis, a lot of people move to the southwest region, and then there is crowding. There is an overload on the water resources. And when there is crowding, whether it's caused by war, by natural resources, or just by urban movement, that's rural exodus, it increases. People are crowding together. They don't have access to clean water. They don't eat clean food, and it greatly increases the chances for cholera. Then also, children are more likely to get cholera because, as you and I know, children, they eat everything they see. Mm-hmm. And cholera is gotten through the oral route. So it's gotten through what you eat or drink. So people that eat or drink indiscriminately, like children, are at greater risk. Then elderly persons above 65, their immune system is weakened. So the moment they come in contact with the Vibrio cholerae, that's the bacterium that causes cholera, they are likely going to develop the disease.
So now tell us, is cholera transmissible?
Is cholera
transmissible?
Excessively. Cholera is one of the most transmissible diseases, which means that if one person has cholera and doesn't take the appropriate measures, the person can spread it to everyone else in the community, because it is spread through contaminated fecal matter, like contaminated feces or vomitus. If somebody defecates per se, wipes their anus and doesn't wash their hands, maybe touches the door handle, you come and touch that same door handle, your hands are already contaminated and you could use those hands to infect yourself. Now, the worst thing with cholera is that not everybody manifests symptoms. Some people are infected, but they don't show symptoms, but they are still able to spread the disease. And that is why by the time we usually identify that there's a cholera outbreak, a lot of people are already infected because somebody who is not manifesting any symptoms has been going around definitely spreading the disease.
So now, you just talked about somebody not manifesting symptoms. Can that person equally die, even after not being able to manifest such symptoms?
Well, the issue is, in cholera is a disease where it's not like the moment you have cholera, you must manifest symptoms. No. Some people that have cholera are asymptomatic. And most people that have it actually don't develop symptoms. It's just a very little percentage of them that actually are able to manifest symptoms, especially those with weakened immune systems or that already have slight infections. So together with cholera, they aggravate the scenario and they manifest symptoms. And if left untreated, whether they were initially healthy or not, the moment you manifest cholera symptoms, the symptoms are wild enough to kill you within a day or two.
Okay, let's take a case, maybe let's say a neighbor is manifesting symptoms of cholera. What's the first step I'm supposed to take at the moment I notice such a situation?
Okay, cholera actually, most people who die from cholera die from dehydration. So the first thing when you identify that is to get an ORS. That's an oral rehydration solution, and it's very easily prepared. You just need 1 liter of clean water. That's water that has been boiled and allowed to cool, with a teaspoon of salt and 8 cubes of sugar. So that the person should keep drinking and ensure that they don't become dehydrated while seeking for medical attention. But the first thing is that you should protect yourself. And by protecting yourself, it means that you should not touch the things that a neighbor has touched. You should wash your hands regularly. You should avoid touching the door handles, the toilet handles, and if you have to touch them, you wash your hands immediately after touching them with running water and soap for at least 20 seconds.
But we know it's practically difficult for us to control, let's say, a child of about 5 years who is still not yet matured and can't really tell if I have to wash my hands, all of that. So how do parents try to help their children in such situations?
In scenarios like these, when there are outbreaks of disease, especially contagious diseases, the best thing to do is to implement some sort of isolation.
Okay.
Yes, because the state is not doing mass testing for cholera, which means that they don't just come to a community and then start testing everybody. They only test people that manifest with symptoms, which means that there are some people in the community that have this cholera because they are not manifesting symptoms they have not been tested for. So my advice is usually assume that everyone has cholera until proven otherwise.
So now how can cholera be treated?
Yeah, cholera is not a very difficult disease to treat because it responds very well to treatment, which means that somebody who has cholera, the moment it's identified that you have cholera, it's treated, or they may will have antibiotics because it's a disease of how can I call it? It's caused by bacteria. So you'll get some antibiotics, but the most important thing that you're going to get is going to be fluids. They're going to give you fluids probably through IV, that's through the vein. You're going to get a lot of fluids there, and you're also going to get electrolytes because you're also losing electrolytes. You get fluids and electrolytes, you get them back. And you may also get some medication, like metoclopramide, to stop the vomiting.
Okay, for those who are just joining us on the program, to participate, you can call us through the following numbers: 655-511111 or 652025050. On today's edition of the program, we are talking about how we can better contain cholera. So if you have some questions which you would like our health experts to respond to, now is the time for you to call and ask all of those questions. So back to you, Nurse Liger. Let's now know, is there any cure for cholera? Can we completely eradicate cholera?
Complete eradication of cholera is going to be considerably difficult because our water sources, our oceans, seafood, food vendors, that there's a lot of different ways that cholera can be gotten. Even in the U.S., that's not completely eradicated cholera because people that eat seafood, probably that's coming from the Gulf of Mexico, and it's not properly cooked, they still get contaminated. Like now, there is this common meal that people enjoy a lot here in Cameroon called shrimp. That's seafood, and a lot of people empty sewage into the ocean, and this sewage may contain that bacteria. If you don't cook those shrimps well, you're going to eat it, and you're going to get infected. And so it's very difficult to eliminate, to eradicate cholera. The best we can do is to protect ourselves as individuals. But we could also reduce the risk. For example, if we could make clean drinking water available, because as you and I can both bear witness, drinking water is a major issue.
Exactly, in Cameroon. We have a call on the line. We'll be getting back to you. Hello? We just lost that caller. Back to you, nurse.
Okay, so drinking water is a major issue. If we could target sources of drinking water, ensure that people that sell food along the way, they sell food that is up to standards, the food is very hot and well preserved, then they have their medical certificates, they get regularly tested, and then we control the disposal of sewage, then we could considerably reduce the occurrence of typhoid, of cholera.
Okay, now we are talking about treatment. Is there any cure? That means any cure for cholera, or let's say anything to avoid someone from suffering with cholera?
Probably it will just be the habitual changes. It's a bit difficult for you to get something that will protect you from getting cholera. Although there is a vaccine for cholera, but this vaccine is almost always given only for people that are traveling from an area that is not cholera infected. It's called Vaxchora. And it's available primarily in the United States.
But I think Cameroon is already organizing. There's already a cholera. There's already a vaccination campaign which is ongoing in Cameroon, especially in the southwest region.
Exactly, it's essential that people get vaccinated. But this vaccine does not issue long-life immunity.
Okay, how does it work then?
It issues. I don't know the exact cholera that is being used in the southwest as of now, but the Vaxchora vaccine prevents cholera for about, I think, 2 years. I think it prevents cholera for 2 years.
Okay. So now, within the time frame you've given, which is 2 years, doesn't mean the person can't get infected with cholera even after maybe touching an infected person without washing their hands or whatever?
Okay. Vaccines don't give 100% immunity.
We have another. We'll be coming back to that.
Between 90 and 95%.
Hello, nurse. We'll be coming back to that. We have a call on the line. Hello. Hello, sir. Hello. We are so sorry we won't be able to have that caller. Please, whenever you're trying to call, make sure you turn off your receivers. Maybe it's your TV set or it's your radio. Try to turn it off, because when it's on, we are unable to get you clearly. So it's very important for you to turn off those. And we are getting back to our nurse, Nurse Liger. We're talking about the importance of vaccine and how it can, let's say, prevent someone from getting infected.
Okay. We are saying that the vaccine doesn't issue complete immunity.
You have 1 minute.
In contact with the vaccine, it reduces your risk by more than 90%, which means that if 10 people take the vaccine, and 9 of them and all 10 of them come in contact with the virus or with the bacteria,
Yeah.
probably only 1 or none of them will get infected. So when you get the vaccine, it means that even if you come in contact with the infection, you will likely not get infected.
Okay. So what last word do you have for people in cholera-prone areas? What advice do you have for them?
The first advice that I would give to them is that they should wash their hands regularly. And because hand washing is a bit difficult, they should get their hand sanitizers. Second, avoid handshakes. You can give fist bumps or you can give dabs or whatever, but avoid handshakes because somebody will easily spread the contamination through their hand. And if you have gastritis, if there's anyone that has gastritis and is on antacids, they should know that they are at increased risk of this.
Chers clients.
And that's it for this edition of the program You and Your Health, aired on Equinoxe Radio Multimedia. I had as guest Can Cholera. He is a nurse at the St. Austin Medical Center, precisely in Yaoundé, in the political capital. And that's where we end this edition. I got technical assistance from Rafael Defanda. From presentation, I am Immaculate Fogwe. Stay blessed in the company of more programs on Equinoxe Radio and television. So long.